This is a production of Cornell University.
Really delighted today to introduce three of our really excellent scholars here at Cornell that will be talking on the topic of COVID-19 and the resilience of global agricultural systems. So we all know that lots of things have changed. Lots of things have been jeopardized. A lot of things have held up, and we've learned a lot of lessons since March about the resilience of our ag systems and how COVID-19 has played out in different parts of the globe. So what the panel will do today is step through three geographic case studies, Asia, Africa, and upstate New York. And then we're going to pivot into some pre-planned questions and then have some time at the end for open Q&A. So if you do have questions, please, if you think you're going to forget them, pop them into the chat and we'll make sure that we return to them at the end. But I'm delighted to have the three excellent scholars on the panel today. Rachel Bezner-Kerr is a professor in the Department of Global Development. Ed Mabaya is a senior research associate, also in the Department of Global Development. And Prabhu Pingali is a professor in the Dyson School, but also with a joint appointment in global development. Rachel will be speaking about upstate New York, Ed focusing on Africa, and Prabhu on India, the Asian context, and then they will be fielding questions from more of a global perspective after they do some case study review for those geographies. So without any further ado, thank you very much for attending today, and we're going to work from east to west. So starting with Prabhu, and then Ed, and then Rachel. So Prabhu, the floor is yours.
All right. Great to be here. Excited to talk to the Soil and Crop Science seminars series here. As Andrew said, I'd like to talk about Asia and specifically about what's happened with the COVID crisis and how it's affected food systems in India. Let me give you a bottom line here. My bottom line is I have been enormously surprised by how resilient the food systems in India have been to the crisis. And I'll show you some data on that. But I've been extremely concerned about the humanitarian impact of the crisis, which has been primarily the result of a massive reverse migration of millions of poor people from urban areas back to their rural households in a totally unplanned manner. And the government did not program this and did not really think through the implications of this. And the long-term impact of this reverse migration is something that we'll have to keep watching and seeing what happens over time. The third impact I see is long-term chronic impacts on nutrition, especially child nutrition. And that's coming about because of disruptions in some of the safety net programs, especially focused on children in India today. So I'll be coming to all of those issues as we go through this talk, which I hope to do very quickly. But just to give you a timeline here, as you know, the crisis started in December in China. India got its first case by the end of January. By mid-March, there were about 50 cases in India. And then India went into an absolute total lockdown with less than 24 hours notice by March 25th. And it went through those lockdowns, tried to come out, went back in, and all the way up till mid-August, they were in a lockdown mode and finally just came out because there was no way you can keep 1 billion people locked down for forever. And you know, during that period of lockdown, the Indian COVID numbers were actually not too bad, but once the lockdown stopped, those numbers have skyrocketed. And today, India is, I think, number 3 or number 2, depending on who's counting, in terms of total number of cases around the world. So it's a massive problem. It's an ongoing problem that we're observing. And my group, the Tata Cornell Institute, is keeping a track of this as we go along. Just to start with an advertisement, we put out a fairly detailed report on pandemic prices and their implications for nutrition security in India, a fairly data-intensive document that's available on our website. That document went up till end of May, and we haven't updated it, but we've been keeping track of the data since then. So we hope we'll be able to do an updated version of this document, which basically looks at what's happened to food supply, food prices, the urban food supply chain, and then looked at the safety net programs in India, the subsidized food grain distribution system, the public distribution system, the PDS, and also the child development program in India, which is a very large integrated child development program that runs across rural areas in India, and how that's been faring, and the midday meal scheme in schools in India, which is a really important part of nutrition, and how they've been faring. But the big story, of course, is the reverse migration and the loss of income and remittances, which we talked through also. And so those of you who are interested, it's available on the, the Tata Cornell Institute website, and you can download it for free. So one of the issues that we've looked at in great detail is what's happening to urban food prices. So we tracked major urban food markets across the country, and we've tracked them on a weekly basis from March all the way through. We're still doing the tracking now. And we've tracked them for all the major commodities. And I'm just giving you some examples here. We've tracked them for staple grains, for pulses, which is a really important part of the protein diet in India, vegetables, meat, milk, etc. And what we've done is we've compared the weekly data against the same week last year to see what the differences have been. And interestingly enough, if you look at staples, there's been very marginal change that took place in staple grains, and also fairly small change in pulses. The bigger change has been in, the bigger change has been in vegetables. Vegetables saw a fairly dramatic shift upwards in prices during the early part of the lockdown period. But then after that, by mid-May, prices started to come down quite significantly. And today, vegetable prices are fairly close to what they were at the same time last year. And that's because the government very quickly made a decision that if we want to keep urban populations food secure and happy, we better open up the food markets. And so they made food traders essential service providers. And so the supply chains that were broken in the early part of the lockdown opened up, and so you began to see supplies coming in and markets functioning fairly regularly with or without masks for people who are going to them. And so prices came down quite significantly after that. Now, the real challenge has been with employment. And you see here, you see that there was a sharp rise in unemployment rates that took place just as the lockdown happened. And the primary reason for that is a large part of the labor force is casual labor, daily labor, semi-skilled labor that's migrated from rural areas into urban areas. And even in rural areas, in the smaller towns, etc., much of the labor that's employed is in this non-contractual or semi-contractual arrangements. So when the lockdown happened, all of those jobs disappeared overnight. And then that started this massive movement of populations back into rural areas. And there was no transport systems, no railways, no buses, nothing. So a lot of people actually walked several days to get back. It was fairly sad and major humanitarian disaster when you think about it and think about how that happened. But the longer term implications of that was it had a significant effect on the income that goes to rural households. Because with the loss in employment, much of the remittance income that rural households depend on for their food consumption and other consumption dropped overnight. And you saw a big drop in overall consumption that happened. We've been using monthly data that comes out of the survey that cuts across the whole country. It's a consumer monitoring survey. And we're waiting, the last round that we have access to is from June. And so we're waiting for the next round to come in. And what we saw initially was this dramatic drop in overall food expenditures for all the different food groups. And what's interesting is that the drop for staples was much smaller than the drop for some of the other major food groups. And also interesting is the drop in food consumption was much higher in urban areas than in rural areas. But I suspect we're going to see a change now. We're going to, as we see the next round coming in, I think the bigger change we'll see is in some of the more nutritious food groups, such as vegetables, pulses, etc., in rural areas relative to urban areas. And that's primarily because of this income change that's happened, this remittance income. Once we get the next round of data, we'll be able to separate out the effect of the supply chain disruption and the price rise relative to the income drop. And my hypothesis is that that income drop is going to be a much bigger driver of the consumption change that we're going to see. What happened to the safety net programs? So as I mentioned earlier, the public distribution system of subsidized food grains is one of the largest safety net programs in the world, that India provides around 15 kg of free or almost free rice or wheat to every household in rural areas in India per month. Now, when the crisis happened, because of this movement of populations back into rural areas, they actually added another 15 kg additional amounts to this subsidized grain that was provided. We've done a telephone survey across a sample of households that we've been working with in India. And we've asked specifically about their access to this subsidized grain. And all of them, I mean, generally, the majority reported that they had no problem in getting access to this grain. And so from a purely hunger point of view, calorie hunger point of view, we've not seen a dramatic increase in hunger in India despite the crisis. So that's actually good news. But on the bad news side, the drop in the ICDS program, which runs the child welfare schemes and child nutrition schemes, those programs were closed down, and the midday meal program in schools was closed down. And so access to food and nutrition for children became a major issue and continues to be a major issue. So my concern is not so much about hunger. My concern is long-term nutritional implications for children especially children under 5, and then the effects on stunting, etc., that can come in from that. And, and of course, the migration issue continues to be a major concern as we look ahead. Many of these people are still in rural areas. They haven't gone back into the cities. The cities haven't generated that employment opportunities as they used to in the past. And so you still have a whole set of family members who are stuck at home, and they need to be fed. But they're also going to start competing in the rural labor market. And this can have a fairly depressing effect on wages in rural areas. It can also affect marginal working population, especially rural women who depend on uh, employment for weeding and harvesting and transplanting, etc., for their incomes. And now that there's additional family labor available at home, much of that employment for these rural women may be affected. So I'm really concerned about what are some of the longer term implications of this reverse migration that's happened, and whether we can create new and better employment opportunities for these populations in the villages or in the uh, neighborhood towns, etc., rather than having them go all the way back into Mumbai and Delhi, etc. That's a challenge I think the government needs to be thinking through. So basically, to conclude on the implications for food security, I think the staple grain prices have remained fairly stable, and the vegetables and other nutritional crops are coming back towards normal trends. So it speaks to fairly significant resilience of the food system itself. Whether the supply disruptions will continue into the future in urban areas, if this crisis continues, is a question mark. But in my view, I think we're not going to see that disruptions in food supplies. What we're going to see is implications for unemployment continuing to be high, the loss of remittance income continuing to be high, and that affects food access and diets and diet diversity. And the impact of the shock on diet quality is something that we should be worried about, especially when you think about children and child nutrition. So those of you who are interested in a deeper dive into the India situation, there's a lot of material on our website. We have a whole dedicated section on COVID-19, so I'd invite you to check us out there. Thank you, Andrew.
Great. Thank you so much, Prabhu. And so we'll be returning to questions for Prabhu's presentation at the end. And I'll invite Ed Mabaya to upload his presentation.
Yeah, so while that is being done, I just wanted to start with the qualifier and say that a large part of what Prabhu presented for India bears some similarity with what's happening in Africa as well. So there will be a little bit of an overlap. The second qualifier being that Africa is a large continent, so I'm painting with very broad brush, what is 54 countries, and I'll speak much more to sub-Saharan Africa. So there won't be as many numbers because, this is very generalized, stylized effect of new evidence that we're getting from Africa. So I want to make 5 key points in this opening segment, and this is as follows. The first point I want to make is we have kind of the Africa situation in terms of the pandemic itself is still very much a mystery, or at least to me, I've not had any really convincing one narrative on why Africa has somewhat been spared to date in terms of the epidemiology itself. There are many theories out there, but what I'm showing you right now is the cumulative cases from Johns Hopkins Coronavirus Resource Center. So you can see from this map the map of Africa is very much low numbers in terms of cumulative cases compared to look at the US, for example, and Europe. So this is quite an anomaly. Usually on most maps, Africa is the red one, and the rest of the world is, usually the green side. When you look at the incidence rate, so this is divided by population, you see that it's even less the case. So we still have this big anomaly that many theories have been proposed on why Africa has not been affected as much. I'll mention a few of them here. One of them was the BCG vaccine. Another one is the warm climate in Africa. Another one is relatively youthful population, with Africa having more than 3/4 of the continent under the age of 35. I would say collectively, they might start to explain something, but I don't think they are anywhere close to explaining the anomalies even within Africa itself. So for example, you have pockets in South Africa and in Kenya, and some people have said just it's lack of measurement, there's very little testing in some of this, but you'd also think that hospitals would be starting to fill up by now. Another group that I've had, starting to gain momentum now is maybe people have not given enough credit to key decisions that were made by African leaders. That Africa closed down borders in March of this year, and there already was very little movement. So the disease load there was low from the beginning, and maybe that's a lesson that we need to be sharing with the rest of the world. I will not try to speculate onto which of those is correct, but it suffices to say that in terms of disease load itself, Africa right now has a very, very low incidence. I hope that it continues this way, but this is what we know. We know as of now. So that said, the impact of the pandemic itself has been much more indirect through the agricultural sector. So I'll show two more slides and I'll speak more freely on some of my talking points that I have. One key, a lot of evidence is coming in now from different sources, but this is just very recent, just came out last month in Nature. Just talking about, with this last point that I made, the closure of national boundaries in Africa came with a lot of disruption in movement of people. And it looks like this is having a lot of effects on the planting season for most crops now in Africa. So by every estimate, the disruption in staple food supply, especially for maize and rice, inputs usually come from urban areas, go to rural areas, and products move from rural areas, go to urban areas. All that has been disrupted at local level, domestic level, and the regional level. And this is likely to have significant effects, if not now, in the next season, on the amount of food that is available out there. This report goes on to show, this just shows you the two main staple crops of rice and maize. And you can see there the impact on the growing season. When COVID hit in early March and April, it was really at the key part of the planting season, and that was disrupted. And we're likely to see this effect in a few months from now. So this is something that, disrupted the production system for most of the staple crops. I happened to be the African Development Bank when COVID-19 was declared a global pandemic. And one of my last tasks at the African Development Bank, I actually delivered this to the board in June, was to develop a strategy for the Feed Africa response to COVID-19 that was going to be implemented across the continent. The key measurements that we came up with to minimize disruption of food flow in Africa were 8 key areas. I'll just go through them here because they kind of capture the thinking around that time, some of which has changed. So we decided we were going to invest in about 8 key priority areas. The bank was putting up about $10 billion to help African countries cope with this pandemic. So we did supporting for food delivery, especially targeting the poor and vulnerable populations. We also supported governments in creating stabilization of food prices, either by releasing food from strategic grain reserves. We supported efforts to increase localized food production system. We knew that, and I'll get into this in a little bit, that localized food production was more likely to be stable and impact resilient compared to food that was coming from abroad. We encouraged governments to invest a lot in extension and advisory services so that there was minimal disruption in production. Tried as much as we could, there was still some significant disruption. Post-harvest and agro-processing of highly nutritious foods. So when you talk about fruits and vegetables and meat, highly perishable goods, we realized we needed to invest a lot of resources into preserving the flow of those. Also, policy support for free flow of food and other inputs. We had to declare for most countries that food was essential service. So we created green channels through which food could flow from country to country and within countries and spared from the many of the quarantine measures that were in place. We established some food security task forces that were regional level and also supported several other regional initiatives. I will stop sharing my screen now so I can actually see and talk to the people. And I will make 3 more points about what this pandemic did for food security in Africa. So, important to note that the pandemic came on top of already existing food insecurity on the continent. Africa was already battling with upwards of 74 million people who were food insecure. There was already a climate shock, a lot of climate change. There was conflict. We were dealing with the locust invasion that had taken on all the Horn of Africa. We were dealing with fall armyworm. So when this shock came, it came on pre-existing conditions that just made things worse. And it may be hard to actually disentangle these different effects from COVID-19 compared to what was already existing. So that's something important to note. Another point is that this actually turns out to be a zero-sum game when it comes to public resources. This is something that hit us very, very quickly that, when you're talking about governments, even development community, they have a limited budget. So what you take from, what you put money into health, into education, you have to take that money from somewhere. Governments were faced with this critical decision. We love agriculture, but this is a health crisis. So ministers of health had the biggest, voice, and most of the resources went to health first. And we really had to campaign hard to say that, look, this is more of a food crisis pandemic for Africa than it is a health crisis. And you really had to fight for those resources across the different other sectors as well. So there was a lot of this back and forth depending on where governments were going to allocate their money. Lastly, I want to speak more to which groups have been most affected by this in terms of Africa. The evidence is still coming, and I want to underscore this point that we're just at the beginning of this pandemic. So any conclusions that we make now are likely to be premature. But the evidence that we're seeing so far is that low-income households have been affected the most. Almost by definition, low-income households have been the most vulnerable. At the beginning of the pandemic, there was a rush to buy food by most households to stock up and hoard up, much like what we did to toilet paper. It was happening in Africa. Shelves were getting cleared up. But poor people who live from, hand to mouth do not have that kind of money. So when the shelves were initially emptied, prices went up and poor people did not have money to buy and stock up in there. They don't even have refrigerators to keep their food in. So you're seeing a large part of the affected population being the most poor and vulnerable populations. Within that subgroup, you also have women and children. All the evidence that we're seeing here is being the most affected. And I would say when you compare rural to urban households, rural households at least had the advantage that they had localized food production systems, so they were a little bit more resilient. But a large part of Africa's urban population was employed in the informal sector. And once they lost their flow of income, they did not have any recourse to income that they could use to purchase food. And they did not have the capabilities to grow their own food. So most of them, either if they still had connections to rural areas, they migrated back to their parents' home in the rural areas, increasing the pressure there, much like Prabhu mentioned for India as well. So you're seeing a large part of this human movement from rural to urban areas, and you're seeing the most vulnerable groups bearing the brunt of this pandemic in terms of food insecurity. I'll leave it there for now, and we'll get back to other points related to this. Thanks.
Excellent. Thank you so much, Ed. And over to you, Rachel.
Thank you very much, and it's an honor to be presenting here. And today I'm presenting on something that's quite different from my usual focus, because most of my work is in Malawi in Southern Africa. I have had the privilege of working in New York as a volunteer around COVID-19 and the food system. So that's why I was asked to present on New York. We go from a continent to a country, and now to a region of a state. So and one that you all have, or many of you, I don't want to make assumptions about where you are now, but many of you have experienced directly. So it's a real sweep today. But I'm going to move from food producer over to consumer and looking at the food system. And just to say that my role in looking at New York has been on the Tompkins County COVID-19 Food Task Force, which I co-organized with Rafa Ponte and the late Kirby Edmonds and CCE and others at the start of the pandemic as a response to trying to deal with the impacts on the food system. So in terms of food producers, we know early on there was really challenges in New York around changes in markets. As you had schools closing, as restaurants shut down in the lockdown, that meant a lot of markets that were normally available for producers were gone. And we saw this particularly with the dairy industry, with losing their market in schools and restaurants. They actually had to dump a significant amount of their milk at the beginning of the pandemic, and that got a lot of attention nationally and even internationally. But there were other significant impacts on producers, and it really varied by sector. But a recent survey that the New York state government did found 65% of New York farms were affected negatively by the pandemic. Everything from labor shortages, and this was particularly an issue for the fruit and vegetable industry when you had restrictions on migration and movement into the country, and within states, it led to both shortages and uncertainty about labor supply. And then this real shift in demand and market opportunities. So both soaring demand in some areas, for example, in local meat, there was a really steep increase in local demand or demand for local meat, and reduced demand, for example, restaurants and other institutions that used to be available. So some local fruit and vegetable producers who had a range of options, who had a range of markets normally, they were able to adjust. But others who depended on some of these institutional sources really struggled. And so there was a lot of variation in the impact and how it was felt. But often a need to pivot in the way that their product was sold. And sometimes that meant learning new skills, learning how to market things online, learning how to work through new distributors. And so real steep learning curve. And for those who were planting crop-based producers, often at a time when they were having to plan at the beginning of the season what to plant. So really high stress circumstance for farmers, for producers across the state. And this wasn't only felt for producers, it was really felt for farm workers. And farm workers were particularly vulnerable to the impacts of COVID-19, in part because of their own often precarious employment conditions. They initially lacked information about PPE and COVID-19. And the Cornell Farm Worker Program, which is here at Cornell, has been really essential in providing some critical information to farm workers and really trying to connect with them, as there was a lot of confusion and uncertainty. But also their own living conditions made it difficult. If there was a case, it often spread quickly, and there was some high-profile cases at the beginning of the pandemic that drew attention to this issue. Hard to isolate and hard to prevent spread. And then because of their own employment conditions, sometimes a lack of access to healthcare and testing, which a number of organizations working with farm workers, like the Farm Worker Program here in Ithaca, really tried to, and in the surrounding region, really tried to alleviate, but an ongoing challenge for that particular sector within our community that is not always visible to us, even though they're a crucial part of the food system. Thinking about food retail, there was a real shift, and we all felt it. Ed talked about the rush on food and different supplies, and we certainly saw that in our own grocery stores here in New York State. At the same time, we saw a real loss of jobs for many people working in the food service industry, and a shift towards online delivery and online orders, and a lot of small food retail businesses, restaurants and food businesses closing. So this all made for impacts on the consumer end, but inconsistent supplies in grocery retailers and supply chain disruptions. And that was on the retail side, but then on the consumption side, we have a sort of contrasting stories. On the one hand, there was this surge in interest in joining community-supported agriculture, in buying local, buying from local farmers markets, buying from local farms, in interest in home gardening and canning. There's been shortages of canning supplies in the grocery stores because of this interest, and a lot of kind of relearning home food preparation. So this is a happy story for some, but in contrast, you have rising disparities in access to healthy food. And a recent paper out of the University of Buffalo really highlighted this disparity. So ordering food online is often more expensive. If you're sick at home and you need to have food delivered to your home, that could mean you can't access it easily. SNAP, the supplemental nutrition program here in the United States, isn't always available for online retail. And there was a rise in unemployment, so people had less money available for purchasing food. There was shorter shopping hours that may not be accessible for people who are working several part-time jobs, and less food available when you get to the grocery store at times because of this supply chain disruption. And that was particularly in the early period of the pandemic, as well as school food disruptions. Now, some school programs were able to do home delivery, and in Tompkins County, we were lucky that the school system really shifted and delivered food to kids at home throughout the early lockdown period. But all of this put together led to dramatic surge in food insecurity in the United States and in New York in particular. This is from Feeding America, but there's a recent report put together by Cornell, CCE, and which also documents this rise in food insecurity nationally from 11% to 23%, and an estimated in Tompkins County an increase from 10.3% to 13%, 13.6%. These are preliminary numbers, and I know there's a lot of effort to try to document it at a national scale. But nonetheless, it's been well documented. There is a dramatic surge in food insecurity, and it's being felt more acutely by particular groups of households. So 38% of Black households in the United States are estimated to be food insecure, for example. And alongside this is real challenges with emergency food provision in New York and at a national scale. So we saw for the first few months of the pandemic this dramatic increase in the number of people looking for free food because they had lost their job and they were facing serious shortages, and many had never had to access emergency food prior to this pandemic. And there was a dramatic increase in the amount of food distributed through food banks, which, and we saw this in some of the early headlines in the spring and the summer, with long lineups and waiting for food distribution. And combined with the impacts in the retail food industry, there was a 70% decline in retail food donations, an estimated 70% decline. And they are one of the major two food banks, and retail food groceries are some of the major suppliers of food to food banks. And so this meant that some food banks had to reduce the amount provided to households. So you have increase in demand and a decrease in supply at the same time. And you also saw a reduction in volunteers and staff shortages in a number of food pantries because many sort of older seniors are those who staff and volunteer at food pantries. So real challenge within the emergency food world. Particularly rural food pantries, preliminary reports suggest that they've had particular difficulties with lineups and following, dealing with increased demand and addressing the kind of health requirements and health guidelines. Many of the places where food is distributed are small spaces, so a lot of places had to readjust and find new ways of delivering food in this context. And alongside this, sort of deep challenges to the food system, we saw in New York and in Tompkins County is no exception, a proliferation of real creative responses and an effort to address these needs in our communities. And many of you may have seen, for example, these mutual aid food boxes that were developed and placed around the county where people would put food and other people who needed it would just come and get it. It was an informal system that was developed and kind of arose out of need and interest in helping each other. As I mentioned, I, along with a lot of other players, put together this COVID-19 food task force, which included county government, city government, the Southern Tier food bank, the food bank of the Southern Tier, the CCE, Cornell Farm Workers Program, a whole range of different players came together working across the food system to talk about what challenges were being faced and how to address them together. One of the initiatives that came, there was an initiative at the state level called Nourish New York, but there was a local initiative, Nourish Tompkins, which was getting local food from local food producers and distributing it to a number of different programs that were trying to make sure low-income households had access to healthy food during the pandemic. The Cornell Farm Workers Program developed a list of, I think it was over 1,000 farm workers, their cell phone numbers, to be able to text them information and keep them up to date. And there was a group of volunteers who made homemade masks and delivered it to them. And there has been a real effort at delivering local food to and meals to farm workers who are in isolation because of COVID-19. So these are some examples of some really creative strategies for addressing these challenges during the pandemic. And it was really a combination of nonprofits, local food distributors, some local companies. This is an example from a solidarity garden that was planted with local farmers and local nonprofits to make sure that people had access to food. And so some inspiring stories as well. And I think I'm well under my time. I'm looking at Andy. So just to some initial conclusions, and as Ed and Prabhu both noted, this is kind of early days for having strong conclusions about what's been happening. in New York. But these initial food supply chain disruptions and concerns about high amount of waste because of the shifts in markets, those were kind of the initial experiences of the pandemic. But then there was a successful transitioning to new markets and delivery systems, I would say, amongst many producers. But serious challenges for small and mid-sized producers and small and mid-sized food retailers in this environment. And I highlighted the kind of particular vulnerability of farm workers, both in terms of health impacts and food security impacts during the pandemic, and rising disparities, rising rates of food insecurity, and rising disparities in terms of access to healthy food. And so all of this points to a need to coordinate and communicate better across local and regional food systems, and strengthening local and regional food systems, much as Ed mentioned, is a priority in the African context, a need to ensure that we have a vibrant local and regional food system to be able to respond to these kinds of shocks. The pandemic also highlighted the really inspiring kind of willingness of people to step outside of their normal roles and take on new ones and collaborate and communicate across sectors in ways that were really inspiring, at the same time as highlighting the kind of fragility of low-income households to shocks, and the sort of lack of social safety nets that really support households during these kinds of shocks to ensure that they are food secure and are getting access to nutritious food. So this is a challenge not only in India and in Africa, but also here in New York State, with people of color and low-income households really suffering dramatically from food insecurity and lack of access to nutritious food. And even though there is adequate supply still within the food system. So I think those would be some of the key take-home messages that I would emphasize. I guess one other point in terms of small and mid-sized producers, the Nourish New York program initially really supported large-scale producers, and the COVID-19 Tompkins County COVID-19 Food Task Force really had a chance to discuss this with the New York State organizers of that program, and in the hopes that the future program, if there's further efforts along these lines, that there's an effort to try to support small and mid-sized producers in these kinds of programs, and not just focus on the food supply angle of that program. So that's another kind of take-home message, to keep an eye on small and mid-sized producers as well in these kind of government programs for ensuring access to healthy food. So with that, I'm going to stop sharing my screen. And
Thanks a lot, Rachel. We're almost at the end of our time, so I'm going to ask one simple question, and then if people have the appetite to stay on for a bit, we'll keep the session open for 10-15 minutes so people from the floor can ask questions. But this has been an enormous stress test, of course, for the agri-food systems globally. And probably some systemic weaknesses have been identified, as well as areas of unexpected strength. But for us as a research for development community, I'm curious if you all have some insights on how we should be doing our jobs differently. Has anything come up that suggests that we need new areas of research, new forms of research collaboration, or any other effort that really is responsive towards the resilience challenge that's been illuminated by the COVID-19 challenge? That's all three of you. Turn taking is welcome.
I mean, one of the things we struggled with in the task force was being able to identify who is vulnerable, who is struggling with food insecurity, and how to go about identifying them. I saw that Norman Porticello was on the call earlier, and he's been involved in this, trying to do a survey locally, and so that, being able to quickly identify who's food insecure and how to reach them is a challenge, even in a country like the United States.
I was mute talking. I'll make three very quick points here. The first one is that in Africa, especially, the lack of real-time intelligence on how much food is available was just shocking to me. We in research, all of us, we're happy with FAO stats from 2018. When this pandemic hit, ministers of agriculture were struggling to find out exactly how much rice is in Nigeria. Much of that information is in the hands of private companies. Most of them are very small. So we just did not know how much food is out there. So it's very hard to act and develop policy and measures when you have very little intelligence on what the actual situation looks like. Secondly, I would say for Africa, where the food systems are highly informal, we underestimated how much movement of food is related to movement of people. A lot of food in Africa does not move on these 40-foot containers. It goes by people making a trip to see my cousin in town. I'm going to take this much food with me. And if I'm going from urban to rural areas, I'm going to move with food. The moment you cut the movement of food, of people, inevitably you're going to have a significant impact on the movement of food. So as much as you try to disentangle the two, they're very much intertwined, especially in developing countries. Then the third lesson, which requires a little bit more research, is that really this is the first, I would say, global pandemic that has happened when the world was globalized. So occasionally we had shocks in one part of the world and food could move from one part into another part. This is really making us relook at this resilience of localized food systems that people had started to ignore in a way. We always knew our rice would somehow get grown in Canada and end up at people would have bread in Zimbabwe. And we didn't pay attention to what happens in between. For the first time, people were just shocked that, everybody was looking after themselves. In the first 3 months, all these countries were panicking. They said, we're going to take care of ourselves first before we start exporting. Russia, all these big countries. So it really made this local politics and local governments focus on local production and almost a movement back to self-sufficiency, which has its downsides as well, but it really highlighted the importance of localized food system in a pandemic like this one.
Thank you, Prabhu.
So one thing that strikes me is, as people working in food and agriculture, we don't really think too much about the rural-urban integration, not in terms of food supply chains, which you think about a lot, but thinking about how rural households depend on income coming from urban households back to rural households and remittances. And how crucial that income is for survival of rural households and food security of rural households. I think that connection is often missed. And this crisis showed very clearly that once you cut that connection off, rural food insecurity goes through the roof. And people think about rural areas as self-generating, food self-sufficient areas, but rural markets depend a lot on remittances coming from urban areas. And I think one of the lessons that comes out clearly is we need to think about employment security in a much bigger way than we do right now. So if a third of the employment opportunities in India are casual employment without contracts and high risk of termination at any point, then that's not a sustainable way to manage labor markets. And we need to think about long-term solutions for labor markets and even think about more regional, more local, non-agricultural employment opportunities, which can then substitute for these remittance flows that have become so crucial for survival. The other point I want to make is this crisis has shown quite clearly that hunger is no longer an issue of calories. There's more than enough calories to go around. And we shouldn't stick to this 1960s paradigm, which I'm sorry, agriculture scientists still stick to, which is we don't have enough pile of grain. Well, we have more than enough piles of grain. What we don't have is a balanced food system that provides for an adequate diversity of diets. And I think that's an area where we should be thinking about a lot more. Let me stop there.
Excellent. Thank you, Prabhu, and Rachel and Ed. Let me open the floor. Chime in, anybody who has a question.
Hi, everyone. I'm sorry. Oh, good. Can you hear me okay? I'm gonna step away from here for a second so I can take my mask off and you all can hear me better. My phone's going to die soon, so I'm going to ask this fairly quickly, but as there's so much hubbub about vaccines coming out soon, and as that becomes apparent and it hits the market, depending on price, if there are poor countries that need to get their hands on the vaccine, do you foresee these people, these decision makers, maybe prioritizing the vaccine over food security, or is there limitations with receiving the vaccine that may affect food security coming up here in the next year?
It's a very good question. I don't know if I don't know if I have a good answer to that. I mean, first of all, yes, like the point that I raised is that when you're talking from a public expenditure point of view, there's very much a zero-sum game that people don't like to admit. So money that goes, they have finite resources. So the more you put money into one area, such as health, that money has to come from somewhere. In developing countries, it's usually education, health, and agriculture are some of the biggest areas of expenditure. So inevitably, there's likely to be implications that if you put more money in health, you might be investing less in education and in agriculture as well. But I'm hoping that there's going to be a public effort to make sure that we minimize that risk, which I'm glad you're pointing out, but I'm not sure how this is going to play out. It depends what kind of vaccine they have, and it depends what kind of country priorities look like. I don't know if Prabhu and
Well, my response is quite simple. The share of agriculture in the total budgets of most countries is so tiny now, and compared to the share of the budget for health and other infrastructure. So it can't get worse than it is already.
Are you sure, Prabhu?
So we're already at the bottom in terms of priorities.
Other questions from the floor? I have one more. Probably you've talked a lot about remittances and labor markets, and of course this is also relevant to all the other dimensions of the global discussion. But maybe let me ask you, how much of this do you think is permanent change, or not permanent, but a new normal, a new stable state where urban jobs are deprioritized and people are back in the countryside? Or is this just something that we limp through and there will be, we will revert back to what things were like before the pandemic? How much of this do we adapt to, or how much of it do we just endure?
So I see some of the students from my food policy class here. And what I talk about there is the whole structural transformation that we've seen historically with populations moving from rural to urban areas. And that's the normal, right? That's how most developed countries have gone, and that's where developing countries have been going. This crisis really raises the question of whether we can do that differently. And there is potential. I was just having a chat conversation here with David, and the idea of building agro-processing industry, rural enterprises, etc., as new opportunities for employing rural populations and reducing the migrant flow is a way to think about it. And I think it can be done in a more novel way with smartphone technologies, with ICTs and social networks and other systems coming in now, that you can create much more exciting employment opportunities for rural youth today than you could in the past. So I definitely think policy community should be thinking about this more seriously.
Can I add to that point there? I think if you're planning this well, indeed, you'll have a reshift to focus in rural areas and rural production, more young people going out there. But there's much more to it that is more maybe cultural and psychological. Because if you look at, in Africa, how many of those people in urban areas had jobs even before COVID, right? There is this, of course, we've known that's a lure of, I happened to have gone to Zimbabwe last month, and a lot of my cousins have moved from urban areas, have gone back to rural areas now, but they're still saying is the moment this is over, we're all gonna kind of go back. And we all have this, even here in this part of the world, that as soon as this is over, we're gonna go back to the normal. So there is a little bit of a stickiness to that lifestyle that would require some significant re-education and change for people to realign and realize that the new normal is not going back to where you were before. But we really have this mindset that anchors us to opportunities, whether they exist or not in urban areas. There's a pull, then a lure that's gonna require quite some education of especially young people to realize opportunities could be located somewhere else. But if we could fix it that way, I think this would be for long-term benefit of both food security and development overall, that we can create opportunities in rural areas as well.
Thank you, Ed. Rachel, do you want to add to that?
I think I agree that I think part of the solution is trying to support rural areas. There's been a real issue here in New York State with slaughterhouses, for example, for local livestock producers having access to adequate places. Even though there's a rise in demand, there hasn't been adequate slaughterhouse facilities for local producers to meet that demand. And that's part of a bigger picture, which is really policies and programs which have really supported large-scale producers and large companies at the expense of small-scale and mid-sized producers. And you've really seen that in the United States, and that has hollowed out rural economies because fewer people are living in rural places. There's fewer businesses to support fewer producers, and it's been devastating in general for rural America. And this pandemic has highlighted that more. So I would agree that supporting local and regional food producers and distributors and food-related businesses, and making these connections between local consumers getting access to healthy, diverse food sources and supporting a regional economy is a very important learning that we should push for, but it will require a shift in the direction of federal and state policy in general, which has gone in the opposite direction.
Thank you, Rachel. So we're 15 minutes over now. We can probably entertain one more burning question if there is one from the floor. Anyone like to ask a final closing question? All right. With that, are there any parting comments from the panel? We deeply appreciate you coming today. It's really been a treat to hear your perspectives on this. Deeply appreciated on behalf of Soil and Crop Sciences and the SIPS community. But any parting comments? This will, just to remind everyone, this will be recorded, so feel free to point other people to this that couldn't make it today. Ed, go ahead.
I want to say that to me, this COVID pandemic is a new class of natural disasters that, it bears similarities with things that we've had in the past, but it's got some unique aspects to it. The jury is still far from out. So the stories that we're writing today will have to be rewritten 3 or 4 times before we can actually fully do a post-mortem on this. So I'm just urging that these are emerging lessons and they're far from long-term lessons, even though we're very quick to want to make key conclusions out of this. I think more of the effects will be written 5 years from now, more volumes will be written about this and what it did to shape the nature of food security around the world.
Mm-hmm.
I think what strikes me is some of the food security and vulnerability challenges that we see in the developing world, we also see right here in New York State. And you know, our communities are so disattached that we work on India or Africa or the US, but cross-learning is so limited between what's happening in the US and what's happening in the developing world. And it'll be really interesting to build those bridges.
Yes, I would agree, Prabhu. I think that we could learn a lot from listening to each other's experiences. But I just want to thank you for inviting us to this panel, Andy, and it's been a pleasure to talk and to listen to each other. So thank you.
Thanks again,
Thanks
to
a
all
lot.
of you. Really great presentation.
Thank you.
Thanks everyone for attending. Have a good day.
All right.
You too. Bye.
This has been a production of Cornell University, on the web at cornell.edu.